All right, let's get started. I'm excited to get into it. So today I'm going to be talking to you about how lifestyle affects ovulation. And before we get into it, I just wanted to tell you a little bit about myself in case we haven't had the pleasure before. So my name's Ami and I started Food Baby almost a year ago after my own struggles to start a family. So like many of my clients and probably many of you, I assumed that getting pregnant would be quick, easy, and even fun, but that definitely wasn't the case for me. And I struggled to conceive and was also unfortunate enough to have 2 miscarriages in the process. So I found the whole thing really, really challenging, and I felt really helpless in the process. Like I had no control of my body or my fertility at all. Being a dietitian, that made me start to look at the evidence in terms of lifestyle and fertility. And when I started doing that, I was actually so surprised by what I found and how much of a difference you could have on your fertility by changing your lifestyle. And I was also surprised that that information wasn't sort of available to me. My doctors hadn't talked to me about it, and I hadn't really come across it either. So eventually, a few months later, I ended up quitting my job and devoting myself to learning everything I could about diet and fertility, and then sharing that information and that knowledge with other women. So the way I'm doing this is a little bit different. So I'm using technology rather than a traditional one-on-one approach. So as a dietitian, normally we see patients sort of in a clinic, in person, and have consults like that. But I really want to reach more people. So I'm using technology to do that and to also help enable people to make changes better using technology. So I've just launched my first online course, and that's the Optimizing Ovulation course. And it's all about giving you back control of your fertility through making changes to diet and lifestyle. And I do have a special offer for those watching today to do with the course. So if you're interested, make sure you stay to the end to hear all about that. So that's me. And now we can get into it. So today we're going to cover a few different things. When I announced I was doing this webinar, I put Q&As up on my Instagram as well as to my email subscribers. So I've changed the webinar a little bit based on what people have said that they wanted. So we're going to cover what happens in each phase of your cycle and what's considered normal. I think a lot of people have questions about whether or not what they experience is within the realm of normal, and so I'm going to address some of those concerns. Then we'll talk about the benefits of ovulation outside of just fertility, and a bit about what affects ovulation and how it affects ovulation. So anovulation, not ovulating, is responsible for about 30% of infertility. It's the leading cause of infertility. And considering that we say about half of infertility is related to male factors, this is not 30% of female infertility, this is 30% of all infertility. So it's a pretty staggering amount. And we know that almost half of cases of anovulation or ovulatory infertility, as it's also called, can be related back to the lifestyle. So it's a hugely important area, and that's why I've created the course and also why I'm doing this webinar today, because I think not enough people realize that. All right, so we're going to go through the menstrual cycle now. So I've made up this little graph you can see here, and I'll talk you through what's happening in each stage of it, but just to give you an overview. This is ovulation happening here, about in the middle of the graph. We can see the lining of the uterus going down and increasing is displayed by that pale pink. These are the levels of the hormones across the middle. And then down the bottom here, we have what's happening in terms of the follicles. So our menstrual cycle is governed by a quite delicate ebb and flow of hormones, and these all play off each other and are very closely related, but they're also related to everything else that's happening in our bodies in terms of hormones in particular. So anything between 24 and 38 days is considered a normal length cycle. I think one thing when I talk about normal, it's important to note what's normal for you. So if you've been having really short cycles and all of a sudden you're having very long cycles, that's something to consider and think about your lifestyle in terms of that. That being said, a change of up to 9 days cycle to cycle is considered normal. I like to see closer to around 3 days. Otherwise, I think it's probably something to do with your lifestyle that's causing those biggest sort of week to 9 day changes. Anything longer than a 20-day difference between your longest and your shortest cycle is considered having irregular cycles. So that's where we like you to go and see your GP and do some more investigations. I'm going to probably mention the fertile window a bit. So just to clarify, that's the days leading up to ovulation and the day of ovulation. And that's the time that you can get pregnant. Basically, sometimes the day after ovulation, but you're most fertile in those few days before and the day of ovulation. Okay, so your cycle starts at the start of the first day of full flow of your period. So this is when all the levels of hormones are at their lowest. You can see in this start of the graph here. And the lining of your uterus is shredding. Generally 3 to 6 or sometimes 7 days of bleeding is expected, and we look for between 10 and 35 mils of blood mostly, but up to 80 mils is actually considered normal. And again, it's more important about what's normal for you. So if suddenly your period seems really different to how it normally is, either heavier or lighter, that's an indication that something might be going on and something might not be normal. How do you feel in this phase? Well, some people do have the sort of emotional PMS symptoms at this point in their cycle, but other people start to feel relief as soon as the bleeding starts. And this is because shortly after, sometimes the day of, sometimes the day after, your hormone levels do start increasing. And it's 2 key ones. So it's FSH and estrogen that start increasing. And it's really that estrogen that starts making you feel better. However, you do often have those physical symptoms. So cramps, bloating, loose bowels, headaches, things like that. In terms of cramps and loose bowels, these are both caused by the prostaglandin. So these are a signaling molecule in the body, and they cause everything to loosen up. So it's what allows the lining of your uterus to release and to be shed. But because it acts just on the whole pelvic area the same way, this is what also causes loose bowels around your period. So sometimes referred to as period poos. So I think that's really interesting. So they're not sort of just specific to your uterus, they affect the whole pelvic area. All right, so moving into the second half of the follicular phase. So menstruation is considered part of the follicular phase as well. But then after that finishes, and even while that's kind of tapering off, your body starts preparing for ovulation. So firstly, the brain releases FSH. So this is this green line here. And that stands for follicle stimulating hormones. So as it says, it starts getting the ovaries to start maturing several follicles. So it's not just one that you mature, it's several on each ovary that starts to mature at this phase. After a while, a dominant follicle emerges. And this is responsible for increasing the amount of estrogen that's released. And so we can see estrogen is this pink line, and it does start increasing before a dominant follicle sort of is selected or comes out. but the follicle really gets those levels increasing a lot more. The estrogen's also causing the lining of the uterus to start building up again. So when your cycle changes in length, so as I was talking about, you have those differences between cycles, it's usually here that it happens, in the follicular phase. So there's a longer time before ovulation rather than on the other side of the other side of your cycle. So this is the part that can really change. Most people tend to feel pretty good in this phase of their cycle. So they get a boost in mood, they're more clear-headed, productive, social, better at coping with stress. But some people also find they're anxious as well. And again, that's related to this peak in estrogen here. You also are physically more coordinated and have more energy. The estrogen causes your appetite to be reduced, as well as your sex drive to increase. You might notice your cervical mucus is increasing or becoming more watery at this phase. And then we move into ovulation. So the rising levels of estrogen cause the LH, so luteinizing hormone, to spike. So this is what you're testing for on your OPKs, your ovulation predictor kits. And you get this spike just before ovulation occurs. So we can see that the mature follicle here is releasing an egg. So that's ovulation. And the egg only lives 12 to 24 hours. And that's why we'd like you to be having sex or trying to get pregnant, however you're doing that, in your fertile window before ovulation. So the sperm lives about 5 days, and we want that sitting there ready for when that egg is released. Again, like the follicular phase, you're probably feeling pretty good. Definitely a higher sex drive at this point and less inhibitions. Physically, I think this is so interesting. You actually look better around ovulation. Your features are more symmetrical, your lips are redder and fuller, your voice is higher, you're more likely to shop and to wear sexy clothes and makeup around this time. Basically, your body and your mind are trying to get you pregnant. So they're working for you at this point if you're trying to conceive. This is the time where you'll probably have the most cervical mucus, and it can take on that egg white sort of texture. If you've never had egg white cervical mucus, or you don't know what I'm talking about when I say that, do give it a bit of a Google, because there's lots of photos on there that kind of show what you can be looking for. And that's a way that a lot of people track ovulation. It's not the most accurate way, but it definitely is one of the indicators that you're in your fertile window. Some people have ovulation pain. So this is sort of a quite like light pain. It's nothing extreme, but in one side or the other, depending on which ovary is ovulating. And you can have spotting as well. And this is because your cervix opens up to let the sperm in and so they can find their way to the egg, or try and find their way to the egg. And your cervix is actually being closed after your period finishes between then and when you ovulate. So you can see some spotting around ovulation. And that doesn't mean that ovulation has occurred, but it more indicates that your cervix is open, so you are in that fertile window. All right, the luteal phase. So this is people's less favourite phase of the cycle. So what happens here is basically the environment is set for implantation, and your body is waiting to see if conception occurred. So the follicle that contained the egg now becomes the corpus luteum, and that releases progesterone. So that's what's responsible for this peak in progesterone that we see after ovulation. If pregnancy does not occur, the corpus luteum starts to disintegrate and break down, which causes the progesterone levels to break, and the prostaglandin, which I was talking about before, to increase, which then triggers the release of the lining of the uterus. If pregnancy does occur, the corpus luteum continues to produce progesterone. So normally this phase of your cycle is fairly much the same. Sometimes it can vary a day or two, but usually it's the same for every cycle. We know anything between about 10 and 16 days is considered normal. If you're having a shorter luteal phase, so 9 days or less, then that's considered a luteal phase defect or a luteal phase deficiency, and something that you should talk to your doctor about. Many people feel low, tired, moody, even a little bit depressed at this stage of the cycle. If you're feeling clinically depressed, that's actually a specific mental health condition called PMDD, and that's something to go and talk to your doctor about specifically, because you can get actual cyclic depression where you feel depressed in your luteal phase through every cycle, and that's something that you can get some help with. Other people report feeling quite good in terms of feeling more calm and introspective. And I guess the important part to point out in the luteal phase is that it is one phase, but there can be sort of two distinct parts to it. So when your progesterone peaks, you also have a little bit of a peak of estrogen in the middle of the luteal phase. And this is generally where people feel quite good. The hormones are kind of balancing each other, you could say. And it's when they both drop off and all those hormone levels are there at their lowest that you can feel worse. However, in terms of the physical signs, they're more related to the progesterone. So you can often get them when you're getting this progesterone peak. So you have things like bloating, constipation, acne, headaches, and sore breasts. As well as, if you're tracking these things, you often have a higher body temp, and that's why people track basal body or even now core body temp to try and confirm that ovulation occurred. Breathing rate, resting pulse rate also increase, and you can have creamy or dry or less cervical mucus at this point of your cycle as well. I do want to say, in terms of the physical symptoms, that a lot of them are similar to what you get in early pregnancy, especially things like having sore breasts and constipation. And they're because they're both caused by high progesterone. So that's why we try and discourage symptom spotting as hard as it is, because you really will be feeling similar things if you're in the really early days of pregnancy and before sort of 4 weeks, as well as when you're in the luteal phase. So it's one of those really annoying things that you can't really tell much. All right, so why do we need to ovulate? For most of us here, first and foremost is obviously fertility, but it's actually really important for a lot of other things as well. So there's really good evidence that shows that anovulation, not ovulating, is associated with osteoporosis. So that's when your bones don't have as good mineral density, so they're not as sort of solid and strong, and they tend to break easy. And this is a problem for women much more than men, especially at the lower end of the weight spectrum. And having broken bones when you're older can actually have a really big impact. So it's not something we think about a lot now, and not really often that we're breaking bones at this point in our lives. But when you're older and you're having more falls and stuff, a broken bone can be really a huge problem and can even lead to death in some cases. So having a hip fracture really increases your risk of dying as an older person. So it is something that is important. Cardiovascular disease, again, I don't think this is something we think about much as young women, but it is the leading cause of death for women in the developing world still. So definitely something that we want to be reducing our risk of, as well as breast and endometrial cancer. So I think these things just go to show that if you're not ovulating, it's a sign that something's wrong, and a sign that you do need to look into why and to try and do something about it as well. What affects ovulation? So first and foremost, anything that affects your hormones. So I said, looking at this picture here, this is a very delicate balance of hormones that work together, and one triggers the other, and it's all quite a fine balance. So anything that affects your hormones in any way is going to affect ovulation. So that includes certain medical conditions, including reproductive conditions like polycystic ovarian syndrome, hypothalamic amenorrhea. So if you haven't heard of that, that's where your periods stop completely or drastically reduce, and that's usually due to either low energy, high energy expenditure, so low energy intake, high energy expenditure, or high stress levels. It's often seen in women who have very low body fat as well. Menopause, perimenopause, and premature ovarian insufficiency. Other hormone imbalances, so of the reproductive hormones like prolactin, but also of other hormones that react closely, like the thyroid hormone. So hypothyroidism and hypothyroidism both affect ovulation. Breastfeeding, pregnancy, and pregnancy loss. So we know if you're breastfeeding, often you don't ovulate. Obviously, you don't ovulate during pregnancy, but also even if you're not breastfeeding, sometimes shortly after pregnancy, you won't be ovulating. And the same goes for after pregnancy loss. And that's just because you've had those changes in hormones with the pregnancy hormones, and then they often drop off very quickly, or sometimes they take a while to drop off. And so that has impact sometimes for a few months on whether or not you ovulate. Medications, fertility meds, obviously. So the whole point of medications like Clomid and Femara are to induce ovulation, so to make you ovulate. And they work in slightly different ways to do that, but they're interacting with your hormones to do so. And then the IVF medications, including the synthetic hormones themselves, obviously affect ovulation too, as does hormonal contraception. So the way most hormonal contraception works is by preventing ovulation. So there's no chance you can get pregnant if you're not ovulating. And that includes after you've come off the pill. So there can be a few months where your ovulation is affected by the fact that you have been on the pill. For some people, there's kind of no downtime, but for other people, it does take a few months before their bodies start ovulating again. So other medical conditions that aren't specifically reproductive and other medications also affect ovulation because they can affect our hormones. So I don't have time to go into all of them, but I think it's important to know. Your age also affects ovulation, so that sort of counts in this category. So what affects ovulation in terms of lifestyle? Everything. So sleep, jet lag, stress, exercise, toxin exposure, and of course, diet. So to talk about stress firstly for a second. So I think the worst thing you can tell somebody who's struggling to conceive is just to relax and that it'll happen. So I feel like you have to be really sensitive. We have to be sensitive about how we talk about stress and how that affects ovulation. So it does vary person to person, and the level of stress obviously makes a big difference. So I'm definitely not saying if you're stressed, you won't get pregnant, or you're not getting pregnant because you're stressed. But I think it is important to note that it can affect your cycles, and that just might mean you ovulate a few days later when you're feeling really stressed, for example. But definitely not the reason you're not getting pregnant. Toxin exposure, I think, is a really big one that's not discussed often enough. And this is because toxins in our environment, so things like BPA you might have heard of, which is a plasticizer that used to be basically in everything, and now people are starting to limit, but there are also other plasticizers and other environmental toxins which have similar effects. Basically, these are considered endocrine disruptors, so they're hormone disruptors, and they affect our hormones in our body, and so they can affect ovulation and fertility as well. Diet. So how does food affect ovulation? First and foremost, as I said, anything that affects our hormones affects ovulation. So what we eat affects our hormones. And this happens in lots of different ways, but I'm just going to talk about a few examples now. So firstly, what we eat affects our insulin and our blood sugar levels. So insulin is the hormone that controls our blood sugar or blood glucose levels in our body. And this is really closely related to our reproductive hormones. So we know that their relationship is very much intertwined. So anything that affects insulin does also have a role and effect in terms of influencing our reproductive hormones. So we see this in polycystic ovarian syndrome, and it's a really big part of PCOS, and in people with diabetes, but it matters for everyone. So we know that having better blood sugar balance increases fertility, even if you're don't have any signs of diabetes. So having your blood sugar under control is really important for fertility, and something I talk about quite a lot in the course. But it's one of the key ways that food affects our hormones, which affects ovulation. Phytoestrogens is another. So phytoestrogens are a component of food that can act in a similar way in our bodies to how estrogen acts. So they can act the same way as estrogen or the opposite way of estrogen. And whether or not they do either is based on the type of phytoestrogen, the amount we have, as well as the amount of estrogen in our body. And they seem overall to be helpful, but there's still some sort of things we don't understand about them, and lots of new research coming out. But we know that they definitely affect our hormone levels, and they can then affect ovulation as well. All right, estrogen excretion. So the food we eat, particularly some types of food and the amount of fiber we have, affects how estrogen is removed from our bodies, which then affects the amount of estrogen in our blood. And of course, the amount of estrogen we have affects the amount of the other hormones we have, because they're so closely related. Okay, so the food we eat also affects our gut health, our sleep, our stress levels, and our mood. And as I said before, these things also have flow-on effects to influencing our hormones, which then affect ovulation. So the amount of body fat we carry also has a really big impact on our hormones. So body fat is metabolically active, which means that it releases hormones. So for example, one of the hormones that our fat releases is estrogen. So having more body fat means that you'll be releasing more estrogen, and having low levels of body fat mean you'll be releasing less estrogen. And both these things can have negative consequences. Body fat releases a whole lot more hormones, and it's quite a complicated process, but that's just one example of how the amount of body fat we have influences our hormones. So I said, first and foremost, that what affects ovulation is anything that affects our hormones. But anything that affects the level of inflammation and the level of oxidative stress in our bodies also affects ovulation. Now, this happens in two ways. Firstly, inflammation and oxidative stress impact our hormones, but they also directly impact the follicles and the follicle's ability to mature and to release an egg. So they're acting directly on the ovaries. And we know that food has an impact, a big impact, on the levels of chronic inflammation we have in our bodies, as well as the levels of oxidative stress. And so that's where things like antioxidants come into play in terms of reducing the level of oxidative stress so that that's not harming the follicles as they're trying to develop. So what affects, in terms of food, what affects ovulation? Everything. So there's good evidence now that the macronutrient types and amounts we have, so the amount of carbs, fat, and protein, as well as the types of all those things, have a big impact on our hormones and on ovulation. Our fiber and energy intake, as well as our vitamin and mineral intake, and our intake of things like phytoestrogens. So there's been lots of studies done in this area, and we know that specific things can really benefit ovulation and some things can be really harmful for ovulation as well. Because I can't cover it all in a webinar, I've created the Optimizing Ovulation online course. And this really goes into detail about how different foods, specific foods, affect your cycles and ovulation. And sort of the point of the course is that you can learn about what to eat to support ovulation, but more practically than that is to actually make changes to your diet to optimize your fertility. And after a few cycles, you can actually see the effect of these changes, particularly if you're somebody who has PCOS or you've had irregular cycles or something like that. You can notice the impact of changing your diet on your cycles, which is really amazing, I think, and helps you feel in control of your fertility journey in a way that's not always possible, and also helps you get pregnant faster if you're optimizing your fertility in that way. So the course goes for 4 weeks and it's kicking off on Monday, so the 8th of June. There's lots more information on the website, but I just wanted to point out that I've got a bonus if you book in the next 48 hours. So it's the Optimizing Ovulation Meal Plan. And this is a 7-day meal plan that is based on all the evidence around what helps ovulation and the content of the course. And this is going to be for sale on the website later, but I'm including it as a bonus as part of the course if you book in the next 48 hours. And I think you'll find it's really valuable alongside the course because it gets you that really practical step into actually implementing these changes. I hear a lot of people say, you know, all the information that's provided on Instagram is great, but how do they actually do it themselves? So the course is designed to be really practical, and I think having the bonus meal plan really helps that as well. All right, so that's all that I had planned, but I've got a little bit of time to answer some questions now, if you have any. So let me just see if I can find the question box now. All right. Just give you a minute to ask any questions. Okay, so someone's asked, does food affect ovulation differently for different people? Oh, okay, really great question. Yes and no. So there are some foods that affect ovulation the same for everyone. So one example is trans fats. So trans fats are a component in dairy food, but the trans fat I'm talking about is actually the commercially produced trans fats. So this is partly hydrogenated vegetable oil. So they've changed the structure of vegetable oil to make it more useful for commercial purposes. Basically, it has a longer shelf life, it makes food crunchy, etc. So trans fats affect ovulation for everybody in the same way. Basically, they're terrible. We know that you have a drastically increased chance of having ovulatory infertility, so not being able to conceive because you're not ovulating, if you have a higher intake in trans fats. And you only need a really little amount of trans fats for this to have a really big impact. So I've covered this quite a bit on Instagram, so you might have seen me talking about it before, but I've also made a guide for avoiding trans fats that you can download for free. So I think the link's on my Instagram bio, but it's also on my website if you want to download that. So trans fats is something that affects ovulation and hormones the same way for everyone, and it's terribly. So, but other things can affect people slightly differently. And this is something I definitely cover in the course. And one example I can give is that the type of folate, so folate versus folic acid, affects people differently based on their genes. And I talk a bit about who might need what type of folate in the course. So yes, some foods do affect everyone the same, and then there are some that affect people differently. All right, I see another question here. Do you recommend taking supplements when trying to conceive, and if so, which ones? Yes, I do. There are some supplements that can be really beneficial when you're trying to conceive. It would probably take me an hour to go through the details because it is a little bit different for everyone. Something I've been thinking about putting together is a workshop that you can go through to talking about the different supplements and who might need what and the amounts that you need. It's definitely something that's covered a bit in the course, but it's also, there's so much information out there that I think it's probably something that I'll create something separate on. Yeah. So sorry, that doesn't really answer your question, but yes, there are some supplements that can really help. Folate is one good example, but there are plenty of others as well. All right, anything else? Oh yeah, one more. Yeah, she's saying, you mentioned PCOS when talking about the Optimizing Ovulation course. Is the course suitable for someone with PCOS? Yes, it is, absolutely. So I do talk a little bit about some specific conditions throughout the course, including PCOS, because it's a reason, such a common reason that people aren't ovulating, or that are ovulating much later in their cycles. And we know that making changes to your diet can really impact, can really have a good impact for people who have PCOS. Yes, please do the supplement workshop. Okay, good to know. All right, so another few questions. Does letrozole lose its effectiveness after taking it multiple times? Not in the same way that Clomid does. So for those of you who don't know, Clomid and letrozole are sort of the two main ovulation induction medications. And we know that after 2 or 3 cycles of Clomid, it starts to thin the lining of your uterus, which makes it harder for implantation to occur. So we don't like people doing more than sort of 2 or 3 cycles of Clomid in a row. Letrozole doesn't have the same kind of impact on the lining of your uterus. That being said, if you're taking letrozole time and time again and you're not getting pregnant, it's maybe a sign that you need more help. Definitely something to talk to your fertility doctor about. Most fertility specialists only recommend letrozole for 3 cycles before trying something else. But really importantly, and something that I think most people don't get told by their doctors and don't realize, is that the drug companies recommend that both letrozole and Clomid are taken in conjunction with making changes to your diet and lifestyle. So the kind of thing covered in the course, or seeing a dietitian one-on-one and getting that personalized advice, is part of what you should be doing when you take ovulation induction medication. So I think that's really important and so often overlooked. And I think doctors don't know, or they don't know sort of what advice to give you or where to send you. But along with those medications, you do need to make changes to your diet and lifestyle for them to be the most effective. Okay, I think some questions are coming in the Q&A and some in the chat. Let me just have a look. Also, how do I extend my period? It only goes for 1 to 3 days and I have PCOS. Okay, so 1 day is probably too short to be having your period. However, it does depend on how heavy it is. And it is, when you have a 1 day period, that's probably an indication that you've had an ovulatory cycle. So it's not that we need to do something necessarily to make the period longer, but we need to look back in the previous cycle and work out whether or not you've ovulated in that cycle. And if not, why not? And is there things you can do? So you say you have PCOS, so that could definitely be part of it, but there's definitely lifestyle things we can do. The other thing is to make sure you're building up a good lining of the uterus. So dietary things like making sure you're having plenty of whole grains is important for building up the lining of your uterus. If you're taking ovulation medication, things like soy can actually help increase the lining of your uterus, as well as vitamin E, so plenty of nuts and seeds and things as well. So that will help make sure you have an adequate lining for implantation to occur, but also might increase your period. But if you're not ovulating, you're likely going to have a strange period in that cycle. Okay, I think that's all we have time for, but if you have any more questions, feel free to DM me on Instagram or send me an email. I'd love to hear from you, and yeah, it's been great. Thanks so much for joining me, guys. Bye-bye.